Blepharoplasty is surgery of the eyelids. Blepharo means eyelid and plasty is the surgery. Now, that term can be used to describe anything from simple removal of a little bit of skin all the way to removal of fat pads or transposition of the fat pads and raising of the brows and tightening of the tendons and lifting droopy lids. So it certainly is more complex than you might think at first glance. The upper eyelids have very unique considerations because you're blinking all the time. Your eyes have to open and close fully. We want to make sure that after your procedure that doesn't change at all. Your lower lids need to have a harmonious contour that blends seamlessly into your cheeks and looks natural for you. So with blepharoplasty surgery, our goal is to improve the functionality of your eyelids so you see the best you can see, and to have an aesthetic result that is natural for your face, something that looks like you. We have patients that come in with quote-unquote heavy eyelids or droopy eyelids, and the reason for that droop is variable. Sometimes the brows are too low, and so the brows need to be raised. Sometimes the tendons are too loose, and the tendons need to be tightened. Most often we have patients with just hooded eyes, heavy eyes. That's our number one patient that we see. And in those cases, we remove some of the extra skin and reposition the fat pockets. I've operated on patients as young as 3 days old, and you need to tighten their eyelids because those babies need to see, all the way to my most elderly patient who was 109. And so certainly it's a big range of patients that we treat, and the actual procedure that's done is customized to your needs. So we speak about the exact details required when we see you in person. After surgery, there is some bruising and swelling. That's normal healing. There is a little bit of blurry vision for the first 2 days. That's when the inflammation tends to be the worst. But after those first 2 days, you just notice that everything keeps improving over the next several weeks. And when you come in, we will go through in detail how you can speed this process up with specific strategies that we go into.